We are at University of Helsinki. My name is Timo Honkela and I'm here with my colleague Krista Lagus.
Oh. So I was thinking about why in general we would even want to go beyond our own conceptual system. So if we have this Western medical systems framework of the human health and well-being and the mind, why would we need to even access some other cultural conceptual system to represent this information? And the reason that I see in here is that when you are working within a conceptual system and also kind of a certain view of the mechanism of health, it can represent certain types of information very well, whereas other types of information it kind of is in difficulties of how to handle. For example, the Western medicine tends to break the human into areas of expertise in a certain way. So this means that whenever the health issues fall within that area of expertise, then it is easy to represent or kind of recognize the information coming from the patient to the doctor, and doctor is able to hear it all and take it in and write it down and prescribe something based on that information. But when there are issues that fall within multiple, let's say, regions of this conceptual system, which are quite separately represented in the medical research, in the research networks, it is pretty difficult to make the connections between issues that connect many areas. So whenever there's a patient that is experiencing a health problem or a well-being problem that falls within many of these areas, and when they go to a professional who is experienced in one area and specialized in one area, it's kind of that they have no conceptual framework where to connect the other dots. So some of the dots get connected while the others fall outside, and they are not even recognized, they are not remembered, they are not kind of heard even. And this means that even when patients come over time and again with this their own experiences, that data does not accumulate because there's nothing which could accumulate the data. And it means that there's a wealth of data that is not being represented even in the system, in the conceptual system. And this is maybe one of the reasons why there are some challenges right now in the Western medicine.
How does water serve as a metaphor for these topics?
So one thing that I thought was that there's the possibility of observing different types of bodies of water, like a small pond or a fountain or a river. They're all water, or the sea, but yet they behave quite differently. There are very different phenomena involved. And also there's the question with the fountain. How does technology, the development of technology and the change in our environment due to technology change our everyday lives? And this is maybe often not represented in the current information bodies that we have, but currently there are changes into people's everyday lives, and they cause different phenomena also regarding our health and well-being.
What would you say about the analysis and the technology related to the analysis of these
Of course, there's due to technology, there's also the possibility of collecting new forms of data about our everyday life, and that has not been previously available. To have a long history of personal data regarding what has been going on, and it can also be considered that now it's objective and in some certain way more trustworthy, because previously one had to resort to remembering and maybe taking notes of one's life, but now you can actually look at from your past data what has been, for example, how long have you been walking every day, and all kinds of other measurements. What have you been doing regarding your social media usage? Have you posted a lot? What kind of emotions have you been kind of experiencing based on your post? A lot of things could be analyzed from all this data that is coming together from regarding our lives.
When we have measurement data, we can have context for these conceptual systems, so that the same phenomenon can be considered from one point of view or another point of view, potentially finding useful links, in a way translation between different systems, so that we can serve the communities that traditionally haven't communicated with each other, so that they have a common structure or common view. And keeping in mind that we can't avoid the way how people understand the world in their own way. So a medical doctor, a patient, a practitioner of some other form of well-being related practice cannot easily use the same language, the same conceptual system, but as said, we have these new technologies related to data analysis that can build a bridge between these different conceptual systems, so that we can serve these people to reach each other in a new fruitful way, such that in a way the utility of the information is relevant for each situation. A medical doctor may need one kind of information, a patient, a citizen needs another kind of information. Someone who has a long experience related to some conceptual system can help and provide information, so that these data science methods that are now becoming available can be used to build bridges which have never been available in the history of mankind.